Once again, Kaleida Health Systems is being accused now of putting policies into place that push independent midwives out of their hospitals. FICA Midwifery is currently the only independently owned midwifery practice here in Western New York. They no longer operate in hospitals after Kaleida updated its policy in May. They say without any notice. Mothers are outraged, saying that Buffalo is going backwards when it comes to birthing options. Tonight, 7 Eyewitness News reporter Madison Carter has the story.
Since I got to town, the number of options for independent midwifery have decreased.
Mara Winkler owns FICA Midwifery. When she opened her doors in August of 2017, there was a small pool of independent midwives in the area. Today, her practice is the last one standing.
Hospitals and insurance companies can make it difficult to run a practice as an independent midwife.
She felt the staff at Kaleida hospitals were not receptive to independent midwifery, to the point where Winkler voluntarily resigned her privileges in their hospitals a year ago. Another midwife in the practice kept privileges for births that might require a transfer to the hospital.
For me, being a first-time mom, it was really relieving to me knowing that if I needed a transfer, my care providers would go with me.
That is until May. Now at Kaleida, midwives must be nurses, which is not required by state law. It also says the care provider has to be employed by Kaleida or a group medical practice. FICA says as the only midwives operating at their hospitals independently, these policies were directed at them.
It was kind of disappointing to see that them basically kick them out of the hospitals.
Both of us felt that we were discriminated against in the hospital for women who chose midwifery care and who chose out-of-hospital birth.
FICA's clients have been devastated by the changes.
Policies are one thing on paper, but when they change the way your child comes into the world, it's gut-wrenching.
Winkler says her practice is still strong. Hospital transfers can and will happen when necessary. But as for now, all births are scheduled to take place outside of the hospital, either at the FICA facility or in the mother's home.
It's just another limitation on women's bodies and women's choices, and ultimately access to a safe and positive experience with a hospital transfer is the thing that makes out-of-hospital birth safe.
And Keith, I have to tell you, it's been incredibly difficult to get in touch with Kaleida. For 2 days, they were completely unresponsive. Finally, they acknowledged that I reached out to them about these practices, but they've refused to give me anyone to interview on camera. They wouldn't even send us a statement about their policy updates.
All right, so Kaleida has done this. What about the other hospitals in Western New York?
So if you're giving birth, you really have two choices when it comes to hospital. It's a Kaleida Health System hospital or it's going to be a Catholic Health hospital. Those are your only two options. And when I did reach out, I was specifically told by a representative from Kaleida that this is no different from Catholic Health, right? But I called Catholic Health and they said they do not require their nurses to have a medical license. They don't not require their midwives to be nurses. They also do not require their midwives to be employed by a group or by Catholic Health. So that was completely false as well. So
we don't know if things might change with Kaleida because we haven't heard from them.
We haven't heard from them. We haven't even heard why they decided to update these standards.
All right, Madison, thanks for the story tonight.